In this video, I'm going to talk about the parietal lobe and its structural landmarks in relation to function. Parietal lobe is located here, this region actually, here and here. So this is the parietal lobe. It is separated from the frontal lobe with the central sulcus here, and it is separated from the temporal lobe with the lateral sulcus here. Okay, and posterior to the brain, you have the occipital lobe, and the border between the parietal lobe and the occipital lobe, which can be seen here maybe better, is called the parieto-occipital fissure. It's not very well visible when you see from the lateral view, but in the medial section, it is this long fissure that separates the occipital lobe from the parietal lobe. This is the central sulcus. Okay, this is the parieto-occipital fissure, and this region, this whole region here, is called parietal lobe. This is cingulate gyrus, which is so don't think that some part so it's not like related to parietal lobe. The cingulate gyrus is normally thought to be the part of the limbic lobe, which is involved in the memory and emotions. It is not belonging to the parietal lobe. Okay, so let's remove that. So here is the parietal lobe. And so one of the most important landmark of the parietal lobe is the postcentral gyrus here, which is just found posterior to the central sulcus. And it extends until the postcentral sulcus. So this area, which is called the postcentral gyrus, is the area also responsible for the somatosensation. What is somatosensation? Somatosensation is the sensation of the objects in the external world through touch. So the sensation of the objects in the external world through touch, and that touch can be just straightforward touch, but also where is that? Yes, sensation of temperature on the skin, sensation of the nociception, which is the pain on the skin, or proprioception, which is the sense of the self-movement and body position. Okay, all these senses are described as somatosensation. So that is found that is represented and processed in the postcentral gyrus here. Okay, and one of the important features of this somatosensory postcentral gyrus is that it is, the whole body is actually topologically represented in the postcentral gyrus, and that representation is defined as this one. Where is that? This is the yes, this is the motor map. Yes, this one. That is actually defined as the somatosensory homunculus. Okay, so every part of the body through the skin have a representation here in a very specific way, and that functions contralaterally. All right, so that's called cortical sensory homunculus. Whereas you also have motor homunculus, which is actually found in the precentral gyrus in the frontal lobe, which we described in the previous videos. So then you can easily understand that anterior to the central sulcus, there is this motor homunculus, and posterior to the central sulcus, there is this somatosensory cortical homunculus. And then, if you look at this parietal lobe here, you see that there is one sulcus called intraparietal sulcus, which separates the superior parietal lobule and inferior parietal lobule. So these areas are rather association areas of the parietal cortex, meaning that these areas are involved in the integration of the somatosensory and motor information, as well as auditory and visual information. For example, think about this inferior parietal lobule here. If there is a damage to this region, usually the spatial perception of the contralateral, the spatial perception is ignored, is distorted. I want to show you with this example. You see, these are the people, and these are some tests done on the patients who have a damage in the angular gyrus, which is found, as I already said, in the inferior parietal lobule. So what is typical for these people is that they, for example, when they are asked to draw this cube, they draw only the right part of the cube and ignore the left part when they have a damage in the angular gyrus in the right hemisphere. Or when they are asked to draw this flower, this is what they see and draw. Or when they are asked to draw a clock, this is how do they draw. And when they are asked to select some target objects among the distractors, let's say, for example, just to circle the gray dots here, they only select the ones that are found on the right of the whole picture. Or when they are asked to draw some horizontal line, they tend to ignore the left part. Or when they are asked to name the objects that are found in their surrounding, they actually ignore all the objects that are found in their left part, and they name mostly the right part. And that is because the right hemisphere is in the angular the angular gyrus, which is found in the right hemisphere, is damaged, and that is contralaterally affecting the left spatial awareness of the objects. Okay, so this was an example to show you actually how this brain regions are involved in the integration of these multimodal sensory associations and motor associations, because these people are not blind, or these people actually having their normal sense, but they may have some problems when they have. So the normal sense, for example, is visual sense is processed in the occipital lobe. So, but with this previous example, we understand that those posterior part of the parietal lobe is involved in the integration of these senses. That's why, although the visual system of the patient is fine, because of the damage into the angular gyrus here, you see that the people have this neglect syndrome. This was my summary for the parietal lobe. I hope it was easy for you. Have a good day.